All right, we're back with a part two, continuing on back in the article. All right, so we was right here. It says they specify that this digital ID contains personal identifiers. A newborn whose electronic immunization record is populated with personal identifiable information benefits because health workers can retrieve their records through unique identifiers or demographic details, generate lists of unvaccinated children, and remind parents to bring them for vaccination. It says this is automated cradle to grave traceability. It says the system also enables surveillance across all locations. With a national electronic immunization record, a child can be followed up anywhere within the country and referred electronically from one health facility to another. This is mobile tracking tied to medical compliance, linking vaccine records to income, ethnicity, religion, and social programs. It says the document explicitly endorses merging vaccine status with socioeconomic data, registers that record household asset data for social protection programs, enable monitoring for vaccination coverage by socioeconomic status, such as household income and ethnicity and religion. It says this is a demographic stratification attached to the compliance database, conditioning access to schooling, travels, and services on digital vaccine proof. It says the WHO, which is the World Health Organization, acknowledges and encourages the system that requires vaccine passes for core Salakia civil functions. It says some countries require proof of vaccination for children to access daycare and education, and evidence of other vaccinations is often required for international travel. It says they then underline why digital formats are preferred. It says digital records and certificates are traceable and shareable. The digital traceable means enforceable. It says using digital systems to prevent wasting vaccine on already immune children. It says the authors describe the key rationale, right? It says children's vaccination status is not checked during campaigns, and it says a practice that wastes vaccines on already immune children, right, and exposes them to the risk of adverse events. It says their solution is automated verification to maximize vaccination throughput. It says the digital system is positioned as both a logical enhancer, right? A logistical enhancer and a compliance enforcer. It says national electronic immunization records can transform how measles campaigns and simulatory immunization activities are conducted by enabling on-site confirmation of vaccination status. It says AI system to target individuals, identify unreached, and combat misinformation. It says the WHO document openly promotes artificial intelligence to shape public behavior. AI demonstrates its unity in identifying and targeting the unreached, identifying critical services, bottlenecks, and combating misinformation and optimizing task management. It says they explain additional plan uses. It says additional strategic, applications, include analyzing population level data, predicting service needs and spread of disease, identifying barriers to immunization, and enhancing nutrient and health status assessments via mobile technology. It says this is a predictive analytics paired with influence operations. Global global interoperability, right? Global interoperability. It says standards for international data exchange. It says the authors call for a unified international data standard, recognize fast healthcare and interoperability resources, right, as the global standard for exchange and health data. It says translated vaccine linked personal identified data must be globally shareable. It says that they describe the need for digital public infrastructure. Digital public infrastructure is a foundation and a catalyst for the digital transformation of primary health care. It says this is the architect of the global vaccination compliance network, expansion into everyday interactions. It says the WHO outlines a surveillance model that activates whenever a child interacts with health or community services. Says CHW, who identify children doing home visits and other community activities, right? It says can refer them to vaccination through an electronic immunization registry or electronic child health record. It says this means non-clinical community actors participating in vaccination compliance identification. It says the authors also describe cross-service integration under unvaccinated children can be reached when CHWS's and facility-based providers providing other services collaborate and communicate around individual children in the same electronic child health records. It says every point of contact becomes a checkpoint. Behavior shaping throughout alerts, reminders, and social monitoring. It says the WHO endorses using digital messaging to overcome intention action gaps. It says direct communication with parents in the form of alerts, reminders, and information helps overcome the intention action gap. It says they also prescribe digital surveillance of public sentiment, right? It says active detection and response to misinformation in social media build trust and demand. It says this is official justification, so they saying that's righteous, because the word justification means righteous, right? For monitoring and countering speech. It says acknowledgement of global donor control, right? It says including Gates Foundation. It says at the very end of the article, the financial architect, it stated plainly that the work was supported by the Gates Foundation, INV 0167137. It says this confirms the alignment with the Gates-backed global idea and vaccine registry incentives operating through Gavi, the World Bank, Unify, right, and the WHO. See, it says bottom line in the WHO's own words, the digital transformation is a unique opportunity to address many long-standing challenges in immunization. It says now it is time for bold new approaches. And stakeholders capital, like I always speak about, you got stakeholders capitalism, right? Which I had put a video up on that back a while back. Okay, and it tells you about the stakeholders capitalism, which talks about the SDGs, right? You see, going into what the RFID microchip, which they want to put a mark on everybody. They want to put a charagma in you. All right, you see. So this is what this thing is coming down to. All right, you see, this is like this is one step into it. They got many different forms and ways how they want to do it. See, they trying to be as the Most High. They trying to be like the Heavenly Father Yahweh, but they can't be like the Heavenly Father. See, they trying to say that they better than the Heavenly Father. They trying to say the Heavenly Father didn't create things the correct way. Well, guess what? You a liar. You devil, your miracles are not going to overstand the power of Yahweh Ba'ashem Yahushua. Your miracles are nothing but what they are, artificial, fake. Okay? But the Most High's power is official, and his son's power is official too. And we are going to have spiritual powers on the earth too. All right? So you devils ain't going to be able to stop this truth. You devils ain't going to be able to try to overthrow the power of Yahweh Ba'Shem Yahushai, the Heavenly Father, and his son, the right hand. Okay, his son is the right hand Yahushai. All right? So you devils ain't got no power in your hand. You devils are going to go down. All right? Your kingdom is going to be expurgated, eviscerated, and disintegrated off the face of the earth. All right? Okay? All right? So let's go into the scriptures. Let's get out of there. So this is Psalms, the 10th chapter, and let's go to the second verse. It says, "The wicked in his pride doeth persecute the poor. Let them be taken in the devices that they have imagined." And their devices that they have imagined is what? To enslave and control everybody on the planet. Okay? To chip you, put you in a 15-minute city, smart city, right? Give you that chip. You ran off of what you call off of radiation, 5G, 6G towers. All right, which is going to burn your body, because radiation is going to destroy you. Henceforth, I didn't want to put that chip in you frequencies, UPC, control, track and trace, right? Everywhere you go, monitoring, cameras everywhere. Okay? Gideon, Politier, scraping. Henceforth, what he had a while back, I think it was back a while back, I put a video up on, I think it was back in like 2004 or something, the total